Have you ever felt a burning sensation in your feet? Do your hands or feet become numb for no apparent reason? Have you experienced pins and needles, electric shock like pain, or a feeling that you're walking on cotton? Most people ignore these symptoms, thinking they'll disappear on their own. But what if I told you these could be the earliest signs of neuropathy, a condition that affects millions of people worldwide, and if left untreated, can seriously impact your quality of life? The good news is that understanding neuropathy early and making the right lifestyle and dietary changes may help slow its progression and improve symptoms for some people. Today, I'll explain what neuropathy really is, why it happens, how it affects your daily life, the 3 best foods that support healthy nerves, and practical habits that can help protect your nerves. So stay with me until the end, because the last tip is one of the most important. What is neuropathy? Let's make this simple. Imagine your nervous system as a massive network of electrical wires running throughout your body. These wires carry messages from your brain to your muscles, skin, and internal organs. They tell your muscles to move, your skin to feel heat or cold, and your body how to maintain balance. When these nerves become damaged, the messages become weak, delayed, or completely disrupted. That's neuropathy. Think of it like a damaged phone charger. Sometimes it works, sometimes it doesn't, and sometimes it sparks. Your nerves behave in a similar way when they're injured. Instead of normal signals, the brain may receive confusing messages that feel like burning, tingling, stabbing pain, or numbness. What causes neuropathy? Many people think only diabetes causes neuropathy. Actually, diabetes is the leading cause, but it is far from the only one. Neuropathy may result from poorly controlled diabetes, vitamin B12 deficiency, chronic kidney disease, thyroid disorders, alcohol misuse, certain chemotherapy medications, autoimmune diseases, infections, physical injuries, or nerve compression. Sometimes, despite extensive testing, the exact cause remains unknown. Why does diabetes damage nerves? This is one of the most common questions patients ask. When blood sugar remains high for months or years, excess glucose damages the tiny blood vessels that supply oxygen and nutrients to nerves. Without an adequate blood supply, nerve cells begin to malfunction and eventually may become permanently damaged. That's why controlling blood sugar is one of the most effective ways to reduce the risk of diabetic neuropathy. Early warning signs you should never ignore. Neuropathy usually starts slowly. Watch for symptoms such as tingling or pins and needles, burning feet, especially at night, numbness in the hands or feet, sharp stabbing or electric shock like pain, muscle weakness, difficulty maintaining balance, frequently dropping objects, feet that feel unusually cold or overly sensitive, wounds that go unnoticed because you can't feel them. Many people dismiss these symptoms until they interfere with walking or sleeping. Early evaluation can make a meaningful difference. How neuropathy can change your life. Now let's understand why neuropathy deserves attention. Imagine waking up every morning unable to feel the floor beneath your feet. Imagine walking without knowing whether you've stepped on something sharp. Imagine trying to button your shirt or write your name, but your fingers don't cooperate. Imagine trying to sleep while your feet feel like they're on fire. This isn't just discomfort. Neuropathy can affect walking, driving, sleeping, working, exercise, balance, independence, and emotional well-being. In people with diabetes, loss of sensation in the feet can increase the risk of unnoticed injuries, ulcers, infections, and in severe cases, amputation. This is why prevention and early treatment matter. Can food help? Here's an important point. No food can magically cure neuropathy. However, certain nutrient-rich foods can support nerve health, reduce inflammation, and help your body function better, especially combined with appropriate medical treatment and healthy lifestyle habits.
Let's discuss the 3 best foods. Food number 1, Fatty fish. Examples include salmon, sardines, mackerel, trout. These fish are rich in omega-3 fatty acids. Why are omega-3s important? Because they help reduce inflammation, support the structure of nerve cell membranes, promote healthy blood circulation, and support brain and nervous system function. Aim for 2 servings each week if they fit your dietary needs. Food number 2, leafy green vegetables. Examples are spinach, kale, broccoli, Swiss chard. These vegetables contain folate, vitamin C, magnesium, antioxidants, vitamin K. These nutrients help protect cells from oxidative stress and support normal nerve function. Try including leafy greens in at least 1 meal each day. Food number 3, nuts and seeds. Examples include almonds, walnuts, pumpkin seeds, sunflower seeds, and chia seeds. These foods provide vitamin E, magnesium, zinc, and healthy fats. Vitamin E acts as an antioxidant, helping protect cells from damage, while magnesium plays an important role in normal nerve and muscle function. A small handful daily can be a nutritious snack. Bonus tips for healthier nerves. Food is only one part of the picture. To support nerve health, keep blood sugar within your target range if you have diabetes. Walk or exercise regularly, as advised by your healthcare provider. Stop smoking because smoking reduces blood flow to nerves. Limit alcohol, which can worsen nerve damage. Get enough vitamin B12 if you're deficient, but only after discussing supplementation with your healthcare provider. Wear comfortable footwear and check your feet daily if you have diabetes to detect cuts or blisters early. When should you see a doctor? Don't wait if you have increasing numbness, severe burning pain, difficulty walking, muscle weakness, foot wounds that don't heal, loss of bladder or bowel control. These symptoms require prompt medical evaluation. Final message. Neuropathy doesn't usually develop overnight, and it rarely disappears overnight either. The earlier you recognize the symptoms, identify the cause, and begin appropriate treatment, the better your chances of preserving nerve function and maintaining your quality of life. Healthy eating, regular physical activity, controlling underlying conditions such as diabetes, and following your healthcare provider's advice can all play an important role. Take care of your nerves today, because they quietly take care of you every single day. Call to action. If you found this video informative, please like, share, and subscribe to Health with Dr. Aqil Shah. Comment below, which neuropathy symptom surprised you the most, or what topic would you like me to cover next? Together, let's build a healthier, more informed community, one evidence-based video at a time.